Welcome, everyone. My name is Dr. Gidenji Gitahi. I'm the Group CEO for Amref Health Africa. I'm passionate about universal health coverage. I'm passionate about equity. And I have been with Amref now for 6 years. And I'm really proud to be part of this great organization. And for all of you joining us here today, thank you for being part of the work that we do, because without you, we can't do the work we do. With me here are great colleagues. I have Camilla here, who is the CEO of Amref Health Africa UK. Then I have Lolem Gong, who is the Chief of Staff at Amref Health Africa. We have with us also Dr. Moloken Desta, who is the advisor to the Minister of Health in Ethiopia. We have Rachel Askin, Amref Health Africa UK. And we are going to be joined as well by a community health worker from Zambia called Mombi. And we will be having a conversation here around vaccine equity. So when you look at vaccine inequity dimensions, it's not a singular dimension. I think many of us have discussed it from the eyes of global north, global south, hoarding supply, inadequate supply to the global south. But I want us to expand that view, that vaccine inequity has multiple dimensions. And on one side is inequitable supply. And that inequitable supply has to do with, for example, pricing, because countries that need to purchase the vaccine for themselves cannot afford. And that's why for many of the countries in the global south, the vaccine is being provided through the COVAX facility. On this other side of inequitable access, then you have hesitancy being a big issue, that even where you have vaccines available, people have received information that is not accurate, and there is no system of providing them the accurate information, because we need to strengthen the community health systems and local leaders and local communication. So communication is a critical issue, because without communication of the right information, you create hesitancy, and hesitancy results in inequitable access. People who need the vaccine cannot access it because they got the wrong information. The next thing is health workers, that even as we get the vaccines, you need enough health workers to be able to provide this and even do outreach to be able to give them to the people who can't make it to go to the facility. So for Sub-Saharan Africa, there is minimal access and there is minimal administration. So that's what we need to remember. As you can see, you have about 2.6 doses per 100 people, whereas the world has about 26 doses per 100 people. Remember that Africa accounts for 17% of the global population.
In terms of the COVID vaccination situation in the UK, we have a population of approximately 70 million people. And as I speak today, around more than half, so 38 million people have received their first vaccine dose, with 23 million who have also now received their second dose as well. So are effectively fully vaccinated against the virus. So a huge contrast to the statistics that you've put forward and the numbers that you've put forward for across Africa.
Now, in the continent of Africa is not the same. And the challenges of delivering vaccines to adults, especially who have socioeconomic barriers, gender-related barriers, distance, access to facilities, and the fact that the vaccine is being offered at facilities, very minimal outreach. And governments are having to struggle with this. They're having to wake up every day to think about how do we make sure that the few vaccines we have actually reach the right people. We have with us Dr. Moloken Desta, and Dr. Moloken Desta is a special advisor to Her Excellency Dr. Leah Tedese, the Minister of Health in Ethiopia. And Dr. Moloken, I would like to invite you to talk about how is it in Ethiopia? What's going on?
Thank you, Dr. Kantenji. Thank you, the entire team. So the major challenges, it's obvious. Supply challenge is one of the issues. Again, still we need to figure out. Again, as you can see, that most of the Africans are vaccinating less than 2%. Slow rollout, even though vaccines are available, still we have seen that within the country in different regions, some of the regions are basically consuming very slowly the vaccines. Insufficient funds is one of the big challenges. Then to procure additional vaccines, to train healthcare providers for vaccine distribution, these are also very critical problems. Vaccine safety and hesitancy, a big problem because of the AstraZeneca, blood clotting issues. It really created, at the middle of the vaccine rollout, a big hesitancies. Communities were actually, sitting back to take on those vaccines. Targeting the most at risk, while healthcare providers, you can find them at the health institutions, then the age and some of the comorbidities, it was really very difficult to access and basically to get those pockets, individuals, this segment of the population. Using different vaccines, this is also very important. At the beginning, it was creating some brand hesitancy. So this by itself was another challenge. And disruption of the health service as a result of the COVID, as a result of the political instability, it really created some of the emerging regions unstable. So what are actually the contributions of Amref? So Amref is one of the active participant actually of the implementing partners. So in terms of coordination and collaboration at the national COVID governance, it really give key important roles. And as part of the ICC, Interagency Coordination Committee, National Task Forces, they are really providing support and advice, the office of the minister on the entire immunization communities. In terms of communication and community engagement, actually, Amref is actually engaged in most difficult areas of the country, like, in the emerging regions in Afar and Somali. And because of that, again, we really see a lot of efforts in terms of, community engagements, as well as, community mobilization, and even in terms of, interpersonal communication issues. So you can see that, Amref is really one of the most important critical partners.
And you can see the data that has been shared by Dr. Muluken, showing Zimbabwe at 4.5 is the best in the sub-Saharan Africa. If you look at Morocco, it's done a little better up in the north, but sub-Saharan Africa is very, very low. And this will become a challenge because then the virus has an open free ground to play and mutate. And therefore, even those who've been vaccinated may not be safe if the virus is allowed to mutate, freely in some of these unvaccinated populations. Now, I see Mombi has joined. Mombi is a community health worker from Zambia. Thank you very much for the work you do, Mombi. Community health work in most of our countries is voluntary. It is work that community members do to assist their communities at no pay. It is a passion. We are, as Amref, advocating strongly for remuneration of community health workers because they are central to the health system. So what I would like to ask Mombi is, could you kindly comment on what challenges are you seeing at the community level?
Challenges are there in the sense that as community health workers, we normally work in a community whereby we don't have identification pamphlets and booklets. So we need support in that. And then as community health workers, we work long hours in the community, door to door, giving information, word by mouth, without a bottle of water or a snack. So we also need support in that. We don't have IEC materials, and people need to be mobilized so that they can be vaccinated. Because they are refusing to be vaccinated since the vaccine is new. They think that it's not safe for them. There are a lot of myths and misconception over the vaccine. So as Amref, please support us with identification and IEC materials for easy communication and mobilization.
So for now, I'd like to invite Lolem. Lolem Gong is the Chief of Staff for Amref Health Africa. And Lolem will comment on what Amref is doing across the continent on this vaccine issue.
At Amref, we advocate for pricing, waivers of IPs, and fiscal space, etc. And then we also look at access, and that's really our, I would say, probably the largest portion of the pie. So looking at demand generation in order for vaccination to happen. So when we talk about vaccine inequity, regardless of how many vaccines we get on the continent, if we don't have everything else that's needed for vaccination to happen, we will not reach our vaccination target. And so our sweet spot is really here, where we're able to deliver services, we're able to work at the community level, and then we're really big on advocacy. So whether it's in setting up vaccination centers and mobile clinics, we also are supporting governments to oversee storage and transportation of vaccines, and also training health workers on administering the vaccine. So whether this is through using our curriculum, the curriculum developed and deployed through our mobile platform, LEAP and Mjali, or whether this is working with the ministries of health to create guidelines. And then when we go to the community level, and this is where colleagues such as Mumbi really are the focus for us. We know that our community health workers will reach our communities regardless of where they stay. So in order to reach the communities, we do have to ensure that the people needed to reach the communities are well trained, they're well equipped, and they're safe.
What I would like to do now is, before we go to the Q&A, is ask Camilla, what is the UK doing and what support do you need from us?
So we're launching the Vaccine Solidarity campaign, which is an ambitious fundraising campaign, which is aiming to raise £2.5 million over 2 years, taking us close to the end of 2023. And it's really calling for solidarity with the African continent to ensure people across Africa have access to the COVID-19 vaccine. The current pace of the rollout in Africa does suggest that what we're looking at is a marathon rather than a sprint. The fact is that however successful the vaccination program has been in the UK and in the US, no one is safe until everyone is. And so we're all in this together. And I think we all have, each one of us, a part to play to make a difference.